COVID-19. COVID-19 is an infectious disease caused by the recently found virus known as SARS-CoV-2 or coronavirus. Before the outbreak originated in Wuhan, China on December 2019, there was no information about this virus. Transmission: people and surfaces. People. This disease can spread from person to person through small droplets from the nose or the mouth when the infected person coughs or exhales. Surfaces. These small droplets land on surfaces, which means any person that touches these surfaces and then their eyes, nose or mouth can become infected. Signs and symptoms. Many people infected with COVID-19 show mild symptoms, especially during the first stages of the disease. Thus, you can still catch the disease from an infected person who only has a mere cough or does not feel ill. Typical signs and symptoms. Tiredness. The body feels completely tired, without energy. High fever. The body temperature can exceed 37.3 degrees Celsius. Dry cough. Constantly coughing without expelling any mucus. And difficulty breathing. Breathing actually becomes more difficult. Diagnosis. COVID-19 is diagnosed by laboratory test, polymerase chain reaction, molecule test on a respiratory tract sample. Samples are collected from the nose, throat, and chest. Treatment. Antibiotics do not work against coronavirus. In fact, antibiotics do not treat viral infections. However, antibiotics may be required if bacterial secondary infections develop. Example, provide oxygen to patients with shortness of breath and/or treatment for fever. Protect yourself and prevent the spread of coronavirus. Wash your hands with an alcohol-based sanitizer or with soap and water. Keep a distance of at least 2 meters between yourself and anyone who coughs or sneezes. Try your best not to touch your eyes, your nose, or your mouth. Cover your mouth and your nose with a bent elbow or tissue when coughing. Seek medical attention if you have difficulty breathing and high fever. Follow the directions of your national or local authorities. Protection measures for people that are in or visited infected areas. 1. Stay home if you do not feel well, even if you feel mild symptoms such as headaches, slight fever, and a runny nose. 2. If you need to go out, for example to buy food or supplies, wear a mask to minimize the risk of infecting others. 3. If you have difficulty breathing or have a high fever, seek medical advice as soon as possible. 4. Call your COVID-19 manager and inform them of any recent travel, especially to countries with reported cases. The 3 C's. Cleanliness, contact, crowding. Cleanliness. Wash hands, clean surfaces. Contact. Avoid contact with people who have been exposed. Crowding. Transmission is more likely in crowded places. How to wash your hands. Wet hands under running water. Apply soap and rub palms together. Spread the soap lather over the backs of the hands. Make sure soap gets in between the fingers. Grip fingers on each hand. Make sure to clean thumbs. Press the fingertips into palm of each hand. Dry thoroughly with clean towel or paper towel. How to use a mask. To put on the mask, clean your hands with soap and water or hand sanitizer. Hold the mask by the ear loops and place a loop around each ear. Mold or pinch the stiff edge to the shape of your nose. Pull the bottom of the mask over your mouth and chin. Avoid touching the front of the mask when wearing. To remove the mask, clean your hands with soap and water or hand sanitizer. Avoid touching the front of the mask, only touch the ear loops. Hold both of the ear loops and gently lift and remove the mask. Throw the mask away in the trash can, or place in a sealable plastic bag or container for washing and reuse. Clean your hands with soap and water or hand sanitizer. What measures have South Africa put in place to minimize the risk of transmission? Temperature and fever screening is in place at international airports. If there is a suspected case, procedures are in place for isolation and management. Specimen collection and transport will be arranged so that speedy diagnosis can be made. Suspected cases will be managed at designated hospitals with isolation facilities. Protocols are in place for follow-up case contracts to ensure that the virus does not spread. Facts about COVID-19. Fact: 5G mobile networks do not spread coronavirus. Fact: exposing yourself to the sun or temperatures higher than 25 degrees Celsius does not prevent coronavirus. Fact: you can recover from coronavirus disease. Catching the new coronavirus does not mean you will have it for life. Fact: being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean you are free from coronavirus or any other lung disease. Fact: drinking alcohol does not protect you against coronavirus and can be dangerous. Fact: the new coronavirus can be transmitted in areas with both hot and humid climates. Measures implemented on case-by-case basis: spacing of employees and work areas, deactivation of biometrics and printing, allocated workspace, limited staff members at the workplace at the same time, screening procedures for staff and visitors, provision of PPE and hand sanitizers, sanitation of work areas, allocated isolation rooms, provision of COVID-19 awareness training, work from home policies, virtual meetings, return to work procedures, and cleaning of own cutlery and workspace. Returning home after visiting public places. Take your shoes off before entering home. Spray alcohol on the top and bottom of your shoes. Also do clothes, cell phones, glasses, keys, work utensils, computers. Throw away any receipts and papers. Go to where you can take off your clothes and put them in the washer. Do not touch or sit on any chairs or beds. Go to the bathroom and take a shower and brush your teeth. Now you can hug your family. What do I do if I suspect I have COVID-19? Call your healthcare provider. Provide them with information requested regarding travels and contact with other people. Self-quarantine, even from the ones you live with. Notify your family that you are in self-quarantine. Ask a responsible family member to keep in touch with you. Do not go to a healthcare provider's rooms without an appointment. Do not go to any hospitals. Do not come to work to ask for permission to stay at home. Notify your direct manager or COVID manager. Call the COVID-19 hotline on 0800 029 999 or send a WhatsApp to the COVID-19 helpline on 0600 123 456.